Thank you for watching. We're so excited you're here to learn how to stay healthy during pregnancy. For more helpful tips and weekly videos, please subscribe and hit the bell icon to stay updated. Today, we're diving into gestational diabetes. Your questions answered: diabetes in pregnancy. You'll discover what you need to know to keep you and your baby safe. Let's jump right in. Gestational diabetes, also called diabetes in pregnancy, happens when your body can't produce enough insulin to manage blood sugar levels. This usually occurs around 20 to 24 weeks of pregnancy. Hormones from the placenta, like human placental lactogen, make your body more resistant to insulin. This causes blood sugar to rise. Think of insulin as a key that unlocks sugar for energy, but during pregnancy, that key doesn't work as well. If not managed, gestational diabetes can lead to risks. These include a larger-than-average baby, known as macrosomia, premature birth, or preeclampsia. Preeclampsia is high blood pressure that can be serious for you and your baby. The good news? With early action, you can manage gestational diabetes. According to the American Diabetes Association, most women control it with diet, exercise, and sometimes medication. Today's video is all about gestational diabetes. Your questions answered: diabetes in pregnancy, so let's explore what you need to understand. Some signs of gestational diabetes might feel like normal pregnancy discomforts, but they shouldn't be ignored. For example, you might feel thirstier than usual, even after drinking plenty of water. This happens because high blood sugar makes your body flush out sugar through urine. This dehydrates you, so you're reaching for water all day, maybe even at night. Another sign is frequent urination. High blood sugar makes your kidneys work harder, leading to more bathroom trips. Pregnancy already increases urination, but waking up multiple times at night to pee is a red flag. Fatigue is also common. If you're exhausted despite resting, it could be because your body isn't using sugar effectively for energy. Blurred vision might happen too. High blood sugar can affect the fluid in your eyes' lenses, making things look fuzzy. Lastly, genital itching or frequent infections like yeast infections can occur. High blood sugar creates an environment where bacteria thrive. Eating for gestational diabetes means choosing low glycemic foods to keep blood sugar stable. These include whole grains, vegetables, and lean proteins. Swap white bread for whole grain bread or sugary snacks for berries. A sample breakfast could be oatmeal with almonds and a sliced apple. This keeps you full and your blood sugar steady. For lunch, try a quinoa salad with grilled chicken, spinach, and avocado. Snacks like Greek yogurt with a handful of nuts or sliced veggies with hummus are great choices. Avoid sugary drinks like soda or juice, as they can spike your blood sugar quickly. Instead, drink water or unsweetened herbal tea. Planning meals ahead helps you stay on track. For example, batch cook whole grain dishes on the weekend to make weekday meals easier. Pair this with light exercise like a 20-minute walk after meals to help your body use insulin better. Always check with your doctor before starting any new diet or exercise plan to ensure it's safe for you and your baby. So, what should you do if you notice these issues or want to manage gestational diabetes? First, talk to your doctor right away. If you spot signs like thirst or fatigue, they'll likely recommend a gestational diabetes test, usually between 24 and 28 weeks. This test involves drinking a sugary solution, and they check your blood sugar after an hour or two. Keep a journal of your symptoms or habits. Note how often you're thirsty, how many times you're waking up to pee, or what you're eating to share with your doctor. This helps with a better diagnosis. You can also start healthy habits now. Eat smaller, balanced meals every few hours to avoid blood sugar spikes. Walking for 20 minutes a day or doing prenatal yoga can help your body use insulin better. These are safe for most pregnant women, but always confirm with your healthcare provider. Staying hydrated is key too. Aim for 8 to 10 glasses of water daily and avoid sugary drinks like soda or sweetened coffee. Let's bring this to life with a story. Imagine Emma, a 30-year-old mom who noticed she was thirstier than usual during her second trimester. She thought it was just pregnancy. But when she started waking up 3 times a night to pee and felt exhausted, she told her doctor. They ordered a glucose test, and Emma was diagnosed with gestational diabetes. She worked with her doctor to eat low glycemic meals. She chose quinoa with veggies and grilled chicken and walked daily for 20 minutes after dinner. Emma also kept a food diary to track her meals and blood sugar readings, which helped her stay consistent. By delivery, her baby was healthy at 7 pounds, and her blood sugar was under control. Emma's story shows that taking action early can make a big difference. You can take charge of your health too. Let's talk about the gestational diabetes test in more detail. The glucose screening test is simple and usually done at your doctor's office or a lab. You'll drink a sweet liquid, often described as tasting like sugary soda, and wait for an hour before your blood is drawn. If the results show high blood sugar, you may need a follow-up test called the glucose tolerance test. This one is longer, about 3 hours, and involves fasting overnight, then drinking another sugary solution and having your blood tested multiple times. It sounds like a lot, but it's worth it to catch gestational diabetes early. If diagnosed, your doctor might refer you to a dietitian or diabetes educator. They'll help you create a meal plan tailored to your needs, like choosing low glycemic carbs and healthy fats. For some women, insulin or oral medication is needed, but many manage with lifestyle changes alone. What about risks if gestational diabetes isn't managed? For your baby, high blood sugar can lead to macrosomia, where the baby grows larger than average, sometimes over 9 pounds. This can make delivery harder and increase the chance of a C-section. There's also a risk of low blood sugar in the baby after birth, as their body adjusts to no longer getting high sugar levels from you. For you, gestational diabetes raises the chance of preeclampsia, which involves high blood pressure and can lead to complications like seizures if untreated. It also increases your risk of developing type 2 diabetes later in life, though healthy habits can lower this risk. The good news? Managing gestational diabetes reduces these risks significantly. Regular checkups, a balanced diet, and light exercise make a huge difference. Let's cover some practical tips for everyday life. Start your day with a balanced breakfast to set the tone for stable blood sugar. For example, pair eggs with whole grain toast and a side of berries. Avoid skipping meals, as this can cause blood sugar to dip too low, leading to cravings for sugary foods. Keep healthy snacks handy like carrot sticks, hummus, or a small handful of almonds. If you're craving something sweet, try a piece of dark chocolate with at least 70% cocoa or a small serving of fruit. Check food labels for hidden sugars in things like sauces or yogurt. When dining out, choose grilled or baked options over fried foods and ask for dressings or sauces on the side. If you're feeling overwhelmed, connect with other moms through online forums or local support groups for gestational diabetes. Sharing tips and stories can make the journey easier. Another key point is monitoring your blood sugar. Your doctor might give you a glucometer, a small device to check your blood sugar at home. You'll prick your finger for a tiny drop of blood, usually a few times a day, like before and after meals. It's quick and gets easier with practice. Write down your readings or use an app to track them. This helps you see how foods, exercise, or stress affect your blood sugar. If your numbers are consistently high or low, share them with your doctor to adjust your plan. Stress can also raise blood sugar, so try relaxation techniques like deep breathing or prenatal meditation. Getting enough sleep, about 7 to 8 hours a night, also helps keep your blood sugar stable. For those wondering about delivery and beyond, here's what to expect. If your gestational diabetes is well managed, you can often have a vaginal delivery, though some women may need a C-section if the baby is very large. After birth, your blood sugar usually returns to normal, as the placenta hormones are gone. Your doctor will likely check your blood sugar a few days after delivery, and again at your 6-week postpartum visit. They may also recommend a glucose test 6 to 12 weeks after birth to ensure you don't have type 2 diabetes. Breastfeeding can help regulate blood sugar for both you and your baby, and may lower your risk of type 2 diabetes later. Long-term, keep up healthy habits like eating well and staying active to maintain your health. To wrap up, today we covered gestational diabetes. Your questions answered diabetes in pregnancy. You learned how to spot gestational diabetes symptoms, manage it with diet and exercise, and understand the gestational diabetes test and pregnancy diabetes risks. We're here to empower you with clear, reliable advice for a healthy pregnancy. Comment below. Have you noticed any symptoms or tried these tips? Let us know. Subscribe for more videos on gestational diabetes symptoms, diet, and tips. Check out our playlist on gestational diabetes management for more ideas. Follow us on Instagram for daily pregnancy health tips. Always consult your healthcare provider for personalized medical advice. Thanks for watching and see you in the next video.